new restrictions.
Faced with an already strained healthcare system, Premier François Legault says the added restrictions are necessary. COVID-19 hospitalizations are rising and more healthcare workers are testing positive.
Quebec needs you to provide health care to those who need it.
Starting tomorrow, there will be a curfew between 10 p.m. and 5 a.m. Private gatherings are done and one-family household bubbles are back. Extreme measures aimed at slowing community spread. Ontario's measures today more targeted as cases spread like wildfire. It announced it is cutting capacity limits for large events to 1,000 or 50%, whatever smaller. Also, an admission. The era of widespread testing is over.
We've not thrown in the towel. We've got multiple surveillance options.
Ontario is now giving free PCR testing to high-risk, vulnerable groups, healthcare workers, and patients in hospitals. Those with mild symptoms won't be tested.
The 100,000 test capacity, we're hitting it already. And when 30-40% of the tests are already positive, which a number we've never seen before, we know there's widespread community activity.
That's why people with symptoms are being told to presume it's COVID and to isolate. New rules there, too, down from 10 days in isolation to 5 or 7 if you work in a high-risk healthcare setting. Ontario is focusing on protecting the most vulnerable, now offering those in long-term care homes a 4th dose. In 2 provinces, 2 approaches to Omicron, and concern from some that Ontario may be forced to follow Quebec.
Slowing transmission there is intended, I think, to specifically target the stress on the healthcare system. Ontario isn't feeling it as much as Quebec is yet. And so the urgency to slow transmission is not yet being felt. I'm concerned that we will feel it here, and we may have to enact similar strategies as Quebec is now putting on the table.
All right, Sarah, we heard some concerns there about Ontario's approach, but what are experts saying about Quebec's?
Well, some criticism here as well. Some doctors saying that the Quebec government has already acted too late, and the effects of these latest restrictions won't be felt for at least a few weeks. Janella?
All right, thanks. That's Sarah Levitt.